You're live.
Good afternoon, fellow citizens. I'm Rich Cortez, your Hidalgo County judge. I want to spend some time with you this afternoon to give you an update on this COVID-19 matter and how the county is attempting to prepare as best we can to serve all our citizens here in the county. I also come with a heavy heart, unfortunately. Already, I have received word that 35 of our citizens have passed due to some form of complications because of this COVID-19, which is obviously a very sad situation. And my condolences go out to all the families that lose their loved ones. We all know the pain that's associated with that. Some good news, we have been asking and requesting from the state of Texas to assist us with many of the needs that we have, which I'm going to go over with you in a while. We're going to be receiving 80 additional medical personnel to help us here with the local hospitals. And also we're going to be receiving some funeral directors to help us manage with the various bodies that are associated, with these deaths. I'd like to start first, kind of give you some of the statistics surrounding this COVID-19 and how it's affected, cities, gender, population throughout. So I'd like to put on a PowerPoint now and go over it, real quickly with you. First slide. As you can see, infections by gender, we've had a total of 8,593 positive cases, of which 4,610 or 53.7% were female, and 3,893 or 45.3% were male, and we simply don't have the gender for 90. So it appears that the female gender is taking the brunt of this infection. Next slide. As far as age is concerned, the infections are pretty well coming out heavily, really on the young. You see where the 20s and the 30s and the 40s seem to be the prevalent age in the distribution. This, of course, is probably a likely amount because these are usually the more active persons. And we know that the more active you are, the more you're around people, the higher the probability of being infected, because that's the way this infection passes from person to person. Next slide. Now, a lot are wondering what cities have these infections come from. As you can see, Mission is number one here with 1,345, followed by Edinburgh with 1,336, followed by McAllen, 1,195, and 931 for FAR, and so forth down the line. So, to no surprise, the cities with some of the larger populations appear to be the ones that are more heavily infected. Next slide. And the fatalities by cities, as you can see, McAllen has taken the brunt of this, which there would be 41 fatalities coming from McAllen, 34 from Mission, 23 from FAR, 21 from Edinburgh, and so forth the line, as you can see. Again, most of the larger cities are taking the brunt of the fatalities. Next slide. I think there you go. As you can see, we've done fairly well in the testing. We have 64,721 tests, of which 8,593 have tested positive. We're still pending and waiting on 1,087. And the good news is that 55,072 were negative. A lot of you, next slide, we're asking about testing and what can we do. So right now we have free drive-through testing sites. July the 16th, La Villa Youth Center in La Villa. On July the 17th, at Progreso Early College campus in Progreso. And on July the 18th, Gajendo Veterans Park in Gajendo, Texas. Ages 65 plus come first because they need to be treated special from 9 to 11, and then the general public will go from 11 o'clock. To register, you have that site there that you see on the plan. Next slide. Other testing sites that are going on, of course, the Bert Ogden Arena on 49 South at 169 in Edinburgh is going on from July 15th to the 17th. And you must pre-register by internet to be able to go in there. Next slide. There's also testing sites that you can go to the UT Health RHV drive-through testing, which is in Edinburgh and Mercedes. You must call ahead to schedule an appointment, and the number is there on the screen, 833-887-4863. The cost of testing will be billed to your health insurance. Thank you. A lot has been rumored. You can take the PowerPoint off. A lot has been rumored going over there about hospital capacity. And for the last several weeks, we have been meeting with the hospital CEOs and management of hospitals in trying to understand their needs and trying to understand to what level and event we, the county, can help, and what information or what we can ask and request from the feds and the federal government. Along those lines, when we first got started in trying to defend ourselves from this virus, one of our goals was not to overwhelm our healthcare providers. We were hoping that we would never get to this point. Unfortunately, almost every hospital is at capacity or near capacity, which is very concerning to us. In the discussions that we were having with them, one of the problems that they needed to have to add capacity to all the hospitals was to be able to take patients out of there that still needed some convalescent or some lower level of service, but not the level of service that would require for them to be full-time in the hospital facility. So among the needs that the hospitals have been asking us, and we're working with them in trying to accommodate them with those needs, there was basically two different services that they were asking. As many as 150 to 200 convalescent beds, which means that a COVID patient is now ready to leave the hospital, but still require some services, and in some cases, even dialysis services. As you know, we have a very high level of people that are diabetic and needing other things. Other hospitals are saying, well, I'm already pretty maxed out in my acute care beds, so we need an acute care facility. Everybody's looking for PPE. Oxygen is in very short supply. the vents, the filters. So all of these supplies are in great needs. The biggest problem that we're having, of course, is staffing. Hospitals go 24/7. Usually there's 3 shifts that go every day. A lot of the nurses and the people working there are working overtime. So this is really taxing the people. So what have we done? Well, the federal government sent a DMAT team, which is a disaster management assistance team, over to evaluate all the hospitals and the situation that we were in. I have been in contact with the U.S. Department of Health and Human Resources and continuing to seek, help from them. And they're evaluating our situation before they make a decision as to what type, if any, assistance we're going to receive for them. We also have been pretty much almost in daily contact with Chief Kidd from Texas Department of Emergency Management. Here's where we make our requests for assistance. They're called STAR requests. So we have several requests that are pending that we have asked the state of Texas to help us. And I'll talk about that in a little bit. As you well know, a couple of days ago, people from the Billy Graham organization, it's called the Samaritan Purse, which is a nonprofit, came down to evaluate our area to see if we qualified for them to come in and help us with an alternative care facility, as they did in New York City. They set up in Central Park in New York City, and they were able to help that city deal with the tremendous need that they had. Unfortunately, today we learned that they turned us down, that they're going to go, somewhere else. They felt that probably we would be able to get help from somewhere else, and they needed to go to that area that help was not available. We have been criticized, unfortunately, by some people that we're not moving fast enough and that we're not doing the things that are necessary to help these hospitals, with the things that they need. I want everybody to know that is just simply not true. I want you to know all the things that have to be in place before we can help the hospitals with this alternative site facilities. Licensing. You need to have not only the location, you need to have all the furniture, fixtures, and equipment necessary that goes in it. It has to be management. You have to have management, and you have to have staff. And remember, staff is not just for 8 hours. Staff is 24/7. That means a lot of people. So when all of the hospitals, one more time, when all of the hospitals are already telling you they're shorthanded in staff, so now we're going to go out there and try to find staff. So it is beyond the capabilities of the county for us to do that. We have to ask the state of Texas. We have to ask somebody else to help us with those funding requirements before we can even start trying to put something like that together. The good news is that we're getting close to solving that issue. We're working very well with the hospitals. I tell you what, I'm just so happy, so pleased with all the hospitals that we have here in Hidalgo County. They're really doing their very best to take care of our people here. And we're very close to solving the problem through a combination of help from the hospitals themselves, help from the county, help from the state. It would be nice if we could get some help from the cities also, because they are part of our community. Another area of concern has been transportation. As you know, there's different levels of ambulance services. You have one, which is the 911 operators, which have to be licensed and have contracts with the county and the cities to be able to handle those emergency situations. Well, right now they're maxed out. Many of the ambulances sometimes are having to stay close to the hospital with a patient already, and they can't move because the hospital cannot accept that patient yet because of the capacity constraints, and therefore the patients are outside. Then we have a different layer of ambulances which are typically the ambulances that do a lower level service to pick up and transport patients, to and from hospitals, or to and from doctor offices, stuff like that. We're working very closely, trying to work with the cities to try to give some of those lower level ambulance companies the ability to provide services to the hospitals, so we can increase capacity for there. I didn't know that this was an issue until recently, but the funeral home capacity. We've had, yesterday, we had a meeting with one of the funeral home owners and talking about their capacity. He said that he usually has capacity for 7 bodies, and he's got 18 in his funeral home right now. So unfortunately, that is a problem that we're trying to resolve. Recently, we asked for and are about to receive 2 large trailers, 55 feet or foot of trailers that would accommodate 50 bodies. We plan to put one of them in Westaco and another one in Mission. We already have two of the ones that are owned by the county that are outside our forensic center. Obviously, also, we need help since we have all these transportation problems. We need more help and capacity to pick up bodies as they're occurring. Another area that I wanted to share with you today is that, golly, this virus is just affecting everyone. Here in the county ourselves, we're already over 200 of our employees that have been infected with this virus. Close to 50 at our sheriff's department and about 150 in other county departments. One precinct's administrative staff was just devastated, with so many people being affected there. So we're doing the best we can to create a safe working environment. We're going to do some tele work as much as we can, working off-site and from a distance, trying to take all of the CDC precautions that are out there. But this has really also been a problem for the county. One of the things that also been said of us sometimes, that we're not transparent as to where user of funds or stuff like that. Well, I want everybody to understand and know that one of the mandates that we have as a county is that we have to provide you with a court system, with a judicial system. So we have all these courts, both district courts, county courts of law, JP courts, all of these courts. Well, we cannot continue to do business in an unsafe environment because people are coming in, people are going out constantly. So we're having to retrofit not only the courthouse, but all the offices and all the people to be able to create a safe working environment so we can continue providing those services there. Also, people call me and says, why don't you put this restrictions in place? Why don't you do this? Why don't you do that? Well, as you know, the county judge of every county, and there's 254 counties in the state of Texas, by law was the chief emergency manager for the county. And before May 1st, all the county judges in Texas were in charge of their counties. At that time, this pandemic was new to all of us. And I relied heavily on healthcare officials, physicians, people in the industry to help me navigate to this very difficult times. So I took a very, very conservative approach, and we wanted to make sure that we were not going to overwhelm our healthcare system, that we wanted to minimize the spreading of this terrible disease as much as we can. So we took precautions. Yes, there were consequences. There were religious consequences, financial consequences, physical consequences, emotional consequences, with all those actions that we take. However, when you have a public health emergency, as we did, sometimes it takes drastic measures to deal with a drastic situation. So I was very glad, very happy, and you can criticize me for anything that you want, but with the help of the commissioners that I have and all of the public, all of the county staff, we were able to keep this disease under control all the way up to May the 1st. We had less than 3 people in ICU. We had less than 10 people in the hospital, and we had single digits of infection rates. Unfortunately, when the governor opened up Texas, and we needed to do something. We couldn't continue to stay closed. People needed to work. People needed to go back. Businesses needed to go back to open. We understand that. We accept that. But we have to learn. We have to learn from now what actually has happened. So as a result of that, people continue to say, "Well, shut it down. Why don't you do this? Why don't you do that?" Well, we can't. Right now, we work at the order that the governor tells us to do. We have asked the governor repeatedly to give us more leeway for local control so that we can make decisions here locally as to what we think is the best thing for us to do. So please understand that any controls that we are not using today is not because we don't want to institute those controls. It's because we're under the rule of law, and the rule of law says the governor decides. Another misinformation that's out there, because we get calls, why doesn't the county go to the store? Why doesn't the county go do this, go do that? Well, we have 22 municipalities in Hidalgo County, and we have a sheriff's department. Well, our sheriff department is the law enforcement arm for the rural areas, and each police department is the law enforcement arm for each municipality. So the laws and the rules of the state of Texas, the county, and the municipality are enforced by the municipalities. So we ask all the cities to help us be vigilant and help us enforce the rules that we do have in place, because if we don't do that, then why have those rules if people are not following? The other area that I wanted to share with you a little bit was this lack of transparency, or where are you using your money, or what has happened. As you know, we had a little disagreement, which we worked out. And I'm very happy that we have 22 excellent mayors representing the cities. We worked out our differences, but we received $151 million to help fight this virus. Out of the money that we received, after close examination of the needs of the county, we came up with a number of $37 million that we needed to support county facilities and county initiatives that benefit all the municipalities as well as the rural areas. Again, I told you that we're mandated to have a judicial system. We're mandated to have a health department. We're mandated to have an emergency management department. We're mandated to have a county clerk and a district clerk. Well, all of those departments required for us to invest funds. We learned that there were several things that we didn't have. When we started testing, we had very little capacity to test, very little capacity for supplies and PPE. So we have no room where to store it, and that was important. So we wanted to invest, and we are investing today as we speak in those assets that we didn't have. At the time that the mayors and the commissioners court were negotiating a fair and appropriate way to divide these funds among us to help the people of Hidalgo County, we decided that it was important for us to set aside 10% of the funds for an unknown situation that could occur. To me, it makes sense. It's like you saving, you putting money for your retirement or whatever. It's never a wrong decision to put money aside for an unknown and unforeseen purpose. We put 10%, which is $15 million. The rest of the funds went to the municipalities and the county on the basis of population. So we, the county, received an additional $28 million that we are going to use, we are using now to help those people that live in the rural areas. And I want you to know that almost one third of the people that live in Hidalgo County do not live in the municipality. So we're responsible for helping them. And what we've done to allocate that money in the rural areas is we put aside $7.5 million for a mortgage and rental program to help those people that lost their jobs or suffered financially because of this virus and they couldn't pay the rent or the mortgage, for us to be able to give them assistance. In addition to that, we put aside $4.1 million for small businesses to apply for grants. There were many businesses, many businesses that were hurt financially. So we hope that this fund will help them recover some of their losses. As you know, recently, and I'll talk about that just a little briefly, is our medical physician for the county passed an order to basically say that schools cannot return on face-to-face education until September the 27th, and he has the option to extend that date in the event that the need is there. Well, guess what? If that's the case, and we have thousands of our students that do not have access to broadband, they don't have access to distant learning. So we felt, as a county commissioner's court, on the advising council also of all of the superintendents of all of the schools in Hidalgo County, that we invest some of those funds so we could reach out and improve broadband in those areas. And we put aside a sizable amount of money to do that. So when you total it up, that totals up to more than 28 million. So we're going to use some of the other county funds to help us with that endeavor. I hope it makes sense to you. It certainly makes sense to us. There's not a single nickel, not a single dollar that we're spending out of these funds that do not go for the benefit of Hidalgo County. And Hidalgo County is made up of 22 municipalities in the rural areas. So wherever, one more time, wherever the county spends a dollar, it doesn't go to the county, it goes to the people that make the county, which is 22 municipalities and the rural areas. So I hope that that's very, very clear to everyone. So right now, to report a little update on our mortgage and rental program, we've received over 900 applications for assistance in that area. Unfortunately, only about 25% of those really qualified and were approved to receive. Part of the reason for that was that there were people that lived in municipalities that made applications to the county, which of course were not eligible because we're only servicing those in the rural areas. We have not begun our small business grant program because we were looking for an administrator to put it in place. We have found an administrator, and we believe that by Monday, July the 27th, we're going to be ready to go, take applications, and hopefully start helping some of these people. Today, I have received countless of calls, text messages, emails. What's going on with the shelter in place? There's rumor that it's going to be a lockdown come Friday. I have no knowledge of any of that or wherever that room is started. I'm going to tell you that in the event the governor gives county judges and gives mayors more latitude and more responsibility in making those decisions, I'm one that believes that we already know how to keep ourselves safe. We already know that if we distance ourselves from someone, that if we use face coverings, that if we wash our hands and sanitize close, often touched areas. We don't travel unless it's necessary. We don't gather in large groups, that the probability of you being infected is very, very low. So to me, if we know those things already, I can assure you that we can coexist with being in business and taking those precautions. However, right now we have a crisis. 35 people that passed away just today, maybe more by now, possibly. Okay, that is not acceptable. So to me, drastic situations take drastic measures. And I would be for a shutdown for a few weeks so that we can get control over this virus and start all over again and learn from the things that we've learned in dealing with things, because we cannot allow and continue to have a 15%, 50% infection rate. Right now, our projections at Burt Ogden for testing for the period of July the 7th through July the 16th, which is this coming Friday, we're projecting a little over 19,000 a test, and we're projecting 15% of those tests are going to come up positive. That's almost 3,000 more people. So by wishing that things would get better, they're not going to get better. We have to take action to make it better. And it's going to take a combination of action that we take as a government and action that you take as citizens. And I hope that together through prayer, together through the actions that we take, the understanding for one another, that we take personal responsibility. This is not the time to point fingers and at somebody else and blame somebody else for this. This is a time to take personal responsibility for the actions. Help your neighbor, help yourself, help everyone by taking those precautions. I hope this helps you understand where we are in Hidalgo County. We're working every day as much as we can to get the resources needed to put you in the best position, to help you deal with the infection should you get it, and help you prevent it from getting it. So I thank you for your time. I thank you for listening to this, and we'll be back. We will try to bring more information to you as is needed. So thank you very much, and enjoy the rest of the day.
You're on, Chief. You need to speak. You need to talk. You're on.
Gracias, tengan todos muy buenas tardes. En nombre de nuestro juez del Condado de Hidalgo, Richard Cortez, quisiera presentarles las gráficas de las que él estuvo hablando anteriormente para que podamos estar todos, sepamos todo lo que está sucediendo. Mi nombre es Carolina Terán, representante de esta oficina del juez del condado de Hidalgo. Vamos a ver nuestras gráficas y vamos a hablar de las condiciones en las que nos encontramos en estos momentos sobre toda el área del condado de Hidalgo. Y por supuesto, mientras nuestras personas encargadas de colocar las gráficas nos las van dando, nosotros les tenemos que decir que poco a poco vamos a ir recuperándonos y por supuesto es la condición que tiene en estos momentos el juez, todos los comisionados y todas las diferentes directivas que están con nosotros en este momento acompañándonos en esta situación tan difícil que vivimos aquí en nuestro condado de Hidalgo, en todo el Valle del Río Grande, y es una situación mundial. Vamos entonces con nuestra primera gráfica a ver si la podemos ver para explicar un poco lo que está sucediendo dentro de las personas infectadas. Podemos ver que dentro del total de casos que lleva el condado de Hidalgo son de 8,593 personas. De estas personas, 4,610 personas son femeninas y eso hace un porcentaje de 53.7%. Dentro del área de hombres tenemos a 3,893 personas. Eso nos deja un porcentaje de 45.3%, lo que claramente nos está diciendo que la mayor cantidad de personas infectadas en este momento son las mujeres. Sin embargo, tenemos también un grupo de 90 personas que fueron aquellas que decidieron no ser identificadas y que dentro de la elaboración de sus documentos no definieron ningún sexo, y estas son 90 personas las que tenemos hasta el momento. Así nos vamos a la siguiente gráfica para poder seguir viendo el conteo que tenemos hasta este momento. La parte de las edades están comprendidas desde los 20 hasta los 70 años y por supuesto vemos claramente que nuevamente que el número de personas infectadas es de 8,593 y que el mayor riesgo que tenemos en estos momentos son personas entre los 20 y los 30 años. Necesitamos que todos tomen las precauciones posibles y que entendamos que si estamos en la calle y no llevamos la debida protección, pudiéramos regresar a nuestros hogares y llevar este tipo de virus y entonces depositarlo en casa y enfermar a nuestra propia gente. Vamos a la siguiente gráfica y les decimos entonces que las condiciones de infección sobre nuestras diferentes ciudades están marcadas. Son 22 ciudades las que tenemos sobre el condado de Hidalgo. Sin embargo, la mayor cantidad de casos o de personas que han registrado el coronavirus están en la ciudad de Mission con 1,345 personas. Así nos vamos refiriendo entonces a todo lo que es el área de Edinburgh y de McAllen, que también ocupan los 3 primeros lugares. 1,345 en Mission, 1,336 en la ciudad de Edinburgh y la ciudad de McAllen con 1,195. Más sin embargo, tenemos que ver el resto de las ciudades que también tienen números que, aunque sea una persona, sigue siendo un número bastante alto para nosotros seguir identificando estos casos. Mientras vemos la siguiente gráfica, podemos entonces decirles a ustedes que las condiciones se van haciendo cada vez más difíciles. Estos son los casos que por supuesto siguen estando allí sobre nuestra área. Y por supuesto, la siguiente gráfica nos estará diciendo el total que tenemos de personas que han ido a tomar esta prueba de coronavirus. A ver si podemos mover la gráfica. Gracias. El total que tenemos hasta el momento. Hablamos primero entonces de las fatalidades. Claro que sí, por supuesto, están dentro de las ciudades los números de personas fallecidas y podemos ver claramente cuál es el número en la ciudad de Mercedes. Llevamos 41 personas y así nos vamos sobre la ciudad de Mission con 34, la ciudad de McAllen con 40 y poco a poco podemos ir viendo, y como decíamos anteriormente, mientras llamamos la siguiente gráfica, que a pesar de que la ciudad de Mercedes, repito, tiene una sola persona, eso quiere decir que para nosotros sigue siendo importante el informarle a toda la comunidad cómo vamos. Nuevamente vemos la ciudad de McAllen con 40 y así vamos viendo el desglose completo de personas que desafortunadamente ya no están con nosotros debido a esta pandemia que vivimos sobre el mundo entero. Llamamos nuestra siguiente gráfica, por favor, y les vamos entonces a decir que hay muchos lugares en donde se están haciendo diferentes tipos de pruebas y quiero recordarles que hasta el momento el condado de Hidalgo ha hecho 64,752 pruebas. De estas pruebas, hasta el momento, no alcanzo a ver el número porque tengo una gráfica acá montada, pero les puedo decir que el número de positivos es de 8,593 personas, de personas negativas que afortunadamente no han dado ninguna señal de tener este virus. Son 55,072 personas y tenemos pendientes en nuestro condado de Hidalgo a 1,087 personas sobre el área. Eso quiere decir que tenemos que entonces estar pendientes de lo que se va haciendo mientras podemos llamar a la siguiente gráfica para decirles entonces que hemos realizado sobre el condado de Hidalgo diferentes lugares a donde usted puede hacer completamente gratis este tipo de estudio. En algunos lugares se estuvo haciendo a través de la nariz, en otros lugares se está haciendo ya la prueba a través de la garganta, con el mismo hisopo, o sea, limpiando las áreas, colocándolas adentro de un tubo de ensayo y se va para ser directamente estudiado por los expertos y por supuesto nosotros queremos decirles que hasta el 16 de julio la villa, en el sector de la villa tendremos a un lugar abierto para que usted pueda ir a hacer este tipo de pruebas. En la ciudad de Progreso lo tendremos hasta el 17 de julio, lo estamos viendo claramente sobre nuestra gráfica. Y el 18 de julio también tendremos abierto en la ciudad de Granjeno. Es importante que recordemos que nuestras personas mayores de 65 años entrarán primero a hacer este tipo de pruebas desde las 9 de la mañana hasta las 11 de la mañana. Si usted tiene algún familiar en su casa y necesita que lleve esta prueba para usted saber que está bien, puede aprovechar estos lugares completamente gratis para obtener la información, para hacer el examen y al finalizar a las 11 de la mañana, abriremos al público en general desde las 11 hasta que se terminen estas pruebas. En algunos sectores hay de 300 a 500 pruebas listas para hacerles a ustedes y por supuesto usted puede obtener toda esta información a través de esta página que está apareciendo en pantalla y llamando también a nuestra línea de ayuda aquí en nuestro condado de Hidalgo, el 956-292-7765. Mientras vamos a ver la siguiente gráfica, podemos recordarles también que en el área del Bear Orden Arena estamos haciendo también un nutrido grupo de personas que han ido de diferentes lugares y que por supuesto están tomando esta prueba con el servicio militar que se encuentra allí presente para darles la oportunidad de que usted sea una persona que llene la documentación y como ve es optativo suyo de colocar su identificación para que pueda tener entonces la oportunidad de tener este tipo de examen. Nuevamente, esto se quedará desde el 15 de julio hoy hasta el 17 de julio. Continuaremos en el Bear Orden haciendo toda esta información para ustedes. Así, seguimos directamente a ver si tenemos alguna otra gráfica para decirles también que la Universidad UT Panam también está haciendo este tipo de pruebas en la ciudad de Edinburgh y en la ciudad de Mercedes. Si usted desea, puede llamar al número que está ahí en pantalla, puede hacer su cita y por supuesto allí tendrá la oportunidad de hacerse el examen. Una vez más, 1-833-887-4863. El costo de este examen en algunos sectores, usted lo puede colocar en su seguro. Si usted no tiene un seguro, estos lugares es muy factible que le hagan algún tipo de cobro. Por eso le decíamos anteriormente que el condado de Hidalgo ha dado la opción de que usted pueda ir a estos lugares donde es completamente gratis. Vamos a la gráfica y por supuesto, una vez más, le decimos que este es el número a donde usted puede llamar, como les dije anteriormente. Puede accesar también nuestra página del condado de Hidalgo, hidalgocounty.us, y puede llamar para que sepa exactamente a dónde se están haciendo este tipo de pruebas de coronavirus. Y también cuando usted abra la página de hidalgocounty.us, ahí le aparece el logo que se está usando para el coronavirus. Si usted aprieta en eso, oprime este botón, podrá ver toda la información que en el transcurso de este día y de los días anteriores se ha ido dando. Y por supuesto, los lugares donde el examen es completamente gratis. ¿Necesita más información? Nuevamente, les doy el número 2952-292-7765. Este aparece en pantalla y por supuesto es para que todos y cada uno de ustedes tomen la ventaja y tengan la oportunidad de ver las condiciones en las que ustedes se encuentran en familia y que puedan compartir con todos sus seres queridos y llevarlos para que hagan esta prueba que en algunos sectores, ya vieron, es completamente gratis. Pues bueno, vamos a hablar ahora un poquito acerca de los hospitales. Mucha gente ha estado preguntando que cuál es la condición y cómo estamos. Los hospitales están cerca de su máxima capacidad. Necesitamos que la gente entienda y por supuesto son muchos los rumores que estamos viendo en el transcurso de toda esta exposición que hizo el juez del condado de Hidalgo. Hemos tenido muchas juntas con los diferentes hospitales para ver cómo podemos ayudar a la comunidad y esto continuará. Tenemos que decirles que el nivel de enfermeras y el nivel de los doctores ya están extenuados. Ellos tienen diferentes horarios, se dividen en tres formas y por supuesto estamos tratando de ayudar lo más posible. El condado de Hidalgo ha estado en contacto directo con el grupo de médicos encargados de toda esta situación y se lo hemos ido presentando a ustedes día con día a través de nuestras gráficas, a través de toda la documentación que se está poniendo a través de hidalgocounty.us. Tenemos que tratar todos juntos de disminuir, de reducir este número de casos y la única forma nuevamente es tomando las precauciones de cubrirnos la boca desde la nariz hasta la boca con nuestro tapador y por supuesto limpiarnos las manos y limpiar con frecuencia las áreas que utilizamos adentro de nuestros hogares e inclusive todos aquellos que van dentro de sus lugares de trabajo, mantener sus áreas completamente limpias. Las ambulancias, hemos tenido también algunas personas que nos han preguntado acerca de las ambulancias. Queremos decirles que todas estas que han sido registradas anteriormente a través de nuestras diferentes ciudades, de las 22 ciudades que tiene el condado de Hidalgo y el condado de Hidalgo, se han mantenido completamente a la orden y han ido a diferentes lugares para ayudar a salvaguardar a todo aquel que ha necesitado ayuda. Y por supuesto, lo más importante es buscar a los trabajadores para los hospitales. Hay un equipo que se está evaluando y que estamos viendo la situación, por supuesto, con los diferentes departamentos para ver cómo podemos ayudar a organizar esta condición y mantener todo en completo la forma sanitaria correcta, que es la que necesitamos en toda el área. Se nos ha criticado porque no nos movemos. Tenemos que recordarles que el gobernador precede todas las órdenes que nuestro juez y las directivas van dando. Lo vimos anteriormente cuando nos mantuvimos en un completo encierro y él luego levantó esta orden. Estamos todos afuera, pero la única forma, y seguimos enfatizando, es que todos ayudemos cubriéndonos la cara, desde la nariz hacia la boca, y por supuesto, si guardamos el distanciamiento social y nos limpiamos y nos lavamos las manos, podríamos seguir con la función de este condado como hasta el momento se ha mantenido. Queremos recordarles que en nuestra área, en nuestro condado de Hidalgo, en estas oficinas, hay aproximadamente más de 200 personas ya con el virus, y eso nos ha hecho de alguna manera a crear un horario diferente. Esto también abarca a todas las diferentes dependencias dentro del condado de Hidalgo, en donde necesitamos que ustedes hagan una llamada si tienen algún tipo de corte, si tienen alguna presencia ante el juez o ante cualquiera de las personas que usted recibe a través de su correo. Usted puede obtener toda esta información, es bien importante, marcando el 956-292-7765. Las operadoras son bilingües y le pueden dar toda la información que usted quiere saber. Vamos a hablar ahora un poquito acerca de el día de ayer. El día de ayer se hizo un comunicado de prensa de publicación inmediata, por supuesto, y este lo hizo directamente el doctor Iván Meléndez, la autoridad de salud local del condado de Hidalgo. Él emite este pedido de control, y esto es prácticamente para que las escuelas entiendan de que permanecerán cerradas hasta el 27 de septiembre y que él tiene la potestad de poder cambiar esta fecha si seguimos con un aumento de casos sobre toda el área de nuestro Valle del Río Grande. Todas las escuelas, por supuesto, tienen que saber cuáles son las condiciones y deben de, esto fue emitido el día de ayer y firmado. Esta orden es para todas las escuelas públicas y privadas, desde los grados de pre-kinder, o si usted lo quiere llamar jardines infantiles, hasta el grado 12. No se dará comienzo a las escuelas hasta el 27 de septiembre del 2020, y recuerde que usted debe de presentar también cómo estará operando su escuela 2 semanas antes de que esto ocurra. Y nuevamente les recordamos que si tuviéramos que hacer algún cambio, el doctor Meléndez, quien tiene la potestad en este condado de Hidalgo, sería el encargado de hacer este cambio. Es lo que hasta el momento podemos decirles, y también recordarles a todas aquellas personas que que necesitan una ayuda. Nuestro departamento o nuestra agencia de servicios a la comunidad, conocido como CIA, le puede dar toda la ayuda a aquella persona que no tiene los fondos para hacer un pago y que vive fuera, directamente en las áreas rurales, fuera de la jurisdicción de su ciudad. Es decir, todas las demás personas que vivan en la ciudad y que tengan una necesidad deben comunicarse con su jurisdicción, con su ciudad en donde usted vive, para que ellos le den la ayuda que usted necesita. Esto en cuanto a las agencias de servicio a la comunidad es aquí en el sector rural de nuestro condado de Hidalgo. Así, de esta forma, no quiero cerrar este mensaje de nuestro juez del condado de Hidalgo y de todos los comisionados y las diferentes directivas sin antes recordarle que en las manos de todos y cada uno de nosotros está el salvaguardarnos. Recordarles que si usted se cubre desde la nariz hasta la boca cada vez que salga a público o entre a algún recinto, es importante que usted esté cubierto, que se mantenga así para evitar el contagio. Recuerde lavarse las manos constantemente y, por supuesto, limpiar las superficies, porque mientras hablamos podemos toser, podemos estornudar, y cuando hablamos salen partículas de saliva que se ubican arriba de las áreas en donde estamos, y esto podría, si usted tiene el virus y no lo sabe porque todavía no se ha hecho una prueba, podría dejar el germen y esta persona podría llegar a alguien, tocar el área y, por supuesto, infectarse o llevarlo a su familia. Les recordamos a todos los muchachos, a toda la gente joven, que el mayor número está entre los 20 y los 30. Recuerden que en su familia todos los quieren y que así como ustedes van a salir hoy, pueden regresar a casa e infectar a cualquier familiar y entonces vernos en una situación que no queremos y que sería deplorable para muchos. En sus manos está el mantenernos en casa y no salir si no necesitamos, y por supuesto busque ayuda si necesita. Sin más, me despido, será hasta la próxima, dándoles información constante a través de nuestras diferentes plataformas, Facebook, Twitter, y por supuesto nuestra página de hidalgocounty.us le informa constantemente en inglés y en español. Nos vamos, será hasta la próxima. Les informó Carolina Terán, de la oficina del juez del condado de Hidalgo, Richard Cortez.